Welcome back to Overhead Athletics. We know that elbow extension is always limited in our post-surgical Tommy John, UCL repair, ulnar neuritis, ulnar nerve patients. We're going to go through a video where you can assess your own elbow extension range of motion and try to figure out why is that range of motion actually limited and how much is it actually limited. So then when you go to apply mobilizations and stretches on your own, you can apply the right stretch and the right mobilization so we're doing the right things to the joint and the tissues around the joint. Max Wardell, Overhead Athletic Institute. Today's video is about elbow extension assessment. We've had some questions about this. We've talked about elbow extension mobilizations, different mobilizations a therapist could do, and different mobilizations that you could do on your own. We want to talk about how to assess it. I've seen a lot of crazy things online where people are stretching the biceps way up here, and now they've implicated the anterior shoulder and actually sheared the labrum in the front of the shoulder because the way they've done a bicep stretch, when in fact, we rarely see bicipital shortening in our throwing athletes. So we wanted to go through a way where you could actually look at your elbow extension, look at what's limiting your elbow extension, and then we can better apply mobilizations to help improve that. We essentially have a few things, 3 to 4 things that can limit elbow extension. Weakness in our triceps, which I've seen maybe one time in a throwing athlete. It's very rare unless you're coming out of a surgery, and that's easy to assess the difference in. From there, you have bony deformation or osteophytic changes, which is essentially bone spurring in the elbow. So if you have spurring in the elbow or around the elbow, that can limit your elbow extension. You can have limitations in muscular tissue on the front, so tight muscles, essentially, inflexibility on the front. Something rare, but something we see in our post-surgical patients who have been in a sling. And then we have capsular stiffness, capsular shortening, something that we see in a lot of our athletes, along with our posterior elbow impingement patients, which are, maybe surgical, maybe not surgical. And the way that we address these things is different. So the first thing we like to do is determine, do you have a limitation in elbow extension to begin with? So what we like to do is get up, face a mirror, go into our T position, nice and tall, chest tall, elbows as high as the shoulders, make sure they're even. From there, got my hands on my shoulders and I drop them out into extension. Do I see a variation side to side? If I do see a variation side to side, I want to look at that one more time down by my side. I go sideways to my mirror, elbow pit forward, which is called the cubital fossa. I want both of them forward. And your hand may be at a slightly different angle. Throwers develop a little bit of torsion of the humerus, so we're looking more here rather than down at the hand. So I'm looking there. I'm going to see, okay, those are forward. Now let me look in the mirror. All right, let's see. That's where that one is. That's where that one is. If I see a limitation there, I'm going to go to our next test, which is a little bounce test, and we're going to look at the end field. So what we talked about, we have muscular limitations, bony limitations, and capsular limitations. The last two, bony limitations and capsular limitations, are going to be our most common in throwing athletes because they're commonly or repeatedly going into extension during the throw. So from here, I take total control of my other hand. I'm totally relaxed in my right hand now, and I let it fall into extension. And I let it fall. Now, if I feel a pinch in the back, I'm already thinking there's something bony or something capsular going on, and we'll further assess that. If I feel a stretching in the front, I'm thinking muscular tightness. Rare, but we'll see it from time to time. Now, from there, once I do that, I can actually push a little farther into the range of motion. Now, if you're really painful or you just had an acute injury, I don't want you doing this stuff, because we know inflammation can limit range of motion as well, and maybe you have an injury in there that you don't necessarily know about and you need to get that checked out. Now, if I go here and it feels like it's pushing back into me or it feels bouncy like it wants to rebound, maybe we do have some more muscular tightness. If I don't see that and it feels hard, like it just comes to a firm stop, I'm already thinking capsular or bony. I can differentiate those two fairly easily here. I got a pull. You can use your baseball bat, your golf club, whatever you got. And from there, I come onto the table here, or the bench here. I grab the bench, and I put the bat up on my humerus just above the point of my elbow here. Now, if I'd had pinching or it felt firm or hard, I take the bat and I fulcrum it on my body here. So what I'm doing is I'm pulling it with my left hand backwards. So it's firmly against my arm, I pull backwards. If I feel an increased stretch in the front, I'm gonna say that may be something I improve. If I feel no change in the pinching in the back, maybe I got some bony stuff going on. And a lot of times we'll see these things together. I can see muscular shortening, capsular shortening, and bony deformation or bony adaptation as a result of throwing, and they may all happen together. A lot of times we get shortening of the capsule or shortening of the muscles secondary to instability in the elbow that leads to changes in the bone there. So it's a protective mechanism. Now, if I felt no difference, it still felt pinchy or it still felt like it couldn't go anywhere, we can do two things. The first one is apply a little bit of compression. So I push down on the joint. If that doesn't irritate it, I can then do the same thing. If that improves the symptoms, I probably have a little bit of range of motion left to gain there. If it doesn't, I have the opposite. So now, if I have weight on the bench or some bench that I'm not going to lift up super easy, I pull up on the bench with my body and do the same thing. So now I'm tractioning the joint. If I can get farther into the range with any of those three variations, or it relieves my symptoms here, I probably have a little bit of range of motion left to gain. And sometimes 2 to 5 degrees in range of motion is a huge improvement when you think about slamming into it at the end of the throw. If I have 2 degrees more in my elbow extension, and I'm limited, if I have 2 degrees more, then I can reach internal rotation in the follow through without ever slamming into elbow extension, which is our problem. That's how we develop that posterior elbow impingement, which we'll cover in another video. So one little caveat here, if I go here and this arm is way down there in hyperextension, and this arm is at 180 degrees or maybe even a little beyond, I don't need them to necessarily be even. I don't need to mobilize this arm into hyperextension. If I'm already getting to full extension, that's all I need, that's fine. I'm gonna have some differences. Every thrower that's thrown a lot of throws in their life is gonna have a little bit of difference here in their elbow extension. It's just something that we're gonna develop. Now, if that's pinching, that's a different story. Try to look at it and see if actually gliding this humerus bone forward, which is what we're doing with that bat or that pipe there, makes any change. If it does, I potentially have some sort of capsular restriction there that's limiting me a little bit. How much we can gain back from that, we don't know yet. A lot of times, we'll see muscular tightness as well, muscular stiffness, because we don't ever go into that extreme range of motion because there's pinching. We can stretch the muscle and maybe gain back a couple degrees, but if there's a bony chip in there or a bony spur in there, there's not a lot we can do in terms of therapy. That's going to be something that needs to be excised and pulled out by an orthopedic surgeon. But what we can do is make the most of what you have. So we can either make it less painful by mobilizing the capsule in a specific way, which is a video that we're going to show you here pretty soon, or maybe we just need to stretch and stay away from that range of motion, stay in a pain-free range. So to recap, do you have a limitation? Where are you at 180 degrees? Here? Here. From there, I do a little bounce test with my arm supported. From there, I use my bat and I assess compress, distract, and then in neutral. And my palm is forward, as you see when I do that. If I found that I can improve it with the bat, or maybe I found there's no pinching, and maybe I do have some muscular tightness, and I stretch, and then I develop, okay, now I gained 10 degrees, or 5 degrees, or 3 degrees, and now I did develop a little pinching here in the back, I'll come back and assess it with that stick there. Okay, does that improve it? Yes or no? If yes, I'll do some mobilizations for that elbow. If no, the likelihood that you're going to be able to improve it on your own is very unlikely. The likelihood that you're going to exacerbate something by trying to improve against a bony block, you have a bone hitting another bone, there's not a lot you can do. If you free up the capsule, if the capsule's only freed up, you may get a couple more degrees, but in the end, 2 to 3 degrees can be worth it, but it's only worth it if you don't damage or exacerbate something in the process, so you gotta be very careful. This is one way we do it. I wanted to put this video out because I saw people stretching their biceps in crazy positions and trying a bunch of different mobilizations for the elbow. And when I look at these athletes, I'm wondering, why are we doing this when we could be implicating other tissues such as the labrum in the shoulder, the rotator cuff, impinging things, or even making the elbow worse as a result of the way we're doing the mobilization or the stretch. So those things always have to be done properly, but we need to make sure we're actually doing the right thing. So this way you can kind of assess whether you've got some things that can be stretched in the front of the joint, whether you got some capsular tissue in the front that can be stretched, or whether you have a bony block here. So if you like the video, make sure to subscribe. We're putting out a ton of different videos on elbow and shoulder pathologies, as well as manually done mobilizations and manual therapy, soft tissue mobilization. We're also putting out a bunch of mobilizations and exercises that you can do on your own to improve your mobility.